Platelet-rich plasma, known as PRP, is an injection treatment whereby a patient's own blood is used. Blood contains red cells, white cells, platelets, and plasma. Platelets are very small cells in your blood that are involved in the clotting process. PRP is obtained by separating the plasma and platelets. When the separated platelets are activated and re-injected into the area to be treated, they release a number of enzymes or growth factors which promote healing. This process also attracts stem cells in order to repair tissue. In PRP injections, the patient's own blood is processed at high speeds, resulting in higher concentrations of the patient's own growth and healing factors, which are then re-injected into the injured area, promoting a more potent healing response. Which areas can be treated? The most common areas treated are knee joint, shoulder joint, either the subacromial or subdeltoid bursa, or the glenohumeral joint, SI joints in the low back, hip joint, elbow, wrist, ankle, AC joint, fingers, and toes. We can also do PRP trigger point injections into the neck, back, and any other tender areas. We will get a complete history, do a thorough physical exam, an ultrasound evaluation, and recommend a sensible treatment plan. Risks, benefits, and available alternatives to treat will be discussed. Medications and a home exercise program will be explained to you as well. What is the process of injections with PRP? Prior to treatment, a blood sample of 1 to 2 ounces is extracted from you. This blood is placed in the centrifuge for about 30 minutes. When centrifugation is complete, your plasma will be separated from your red blood cells. The rich platelets are extracted and prepared for injection. The PRP is then injected into the necessary areas under ultrasound guidance after the area is first sterilely prepped with alcohol swabs and ethyl chloride spray is used for topical anesthesia. PRP then gradually promotes the healing cascade. This process and injection time takes approximately 90 minutes in total. How many treatments are required? This will depend on how long you have had your problem and how severe the problem is. Normally, it is advised to have around 3 treatments about 2 weeks apart. How long do the results last? Treatment results vary, however in most patients the results last up to 18 months. Follow-up appointments are done only on an as-needed basis. Who should not have this treatment? Patients who have any kind of blood or clotting disorders and those on anticoagulation therapy. Patients who have poor venous access. Patients that require chronic anti-inflammatory medications. Patients with severe phobias to needles and injections. What are the side effects of injections with PRP? Side effects are minimal. There is always a risk of bleeding and infection with any injection procedure. Generally, after the procedure, pain and stiffness of variable intensity and length is common. You may ice for 20 minutes every hour to reduce pain swelling in the first 48 hours after the procedure. Bruising is possible, but usually very minor and is related to the injection itself. Infection is very rare as sterile equipment and techniques are used. What are reasonable expectations from PRP therapy and are results immediate? Swelling from the fluid is what you will see and feel first. Once the swelling has subsided, you will notice some changes and improvements, and responses vary per patient. PRP therapy will help everyone. It's just a question of how fast you respond to treatment and how many treatments you will need. At follow-up visits, we add growth factor and hyaluronic acid to enhance the PRP response. During treatments, you may exercise, but do not increase your activity level during treatment. In other words, do not try to increase your weights, reps, or distance if it involves the area treated. If the exercise hurts, you may need to discontinue it for a short period of time. If you have any further questions about PRP or want a consultation, give us a call here at Katalyst Wellness.